Hello and welcome. Today we're diving into the world of renal oncocytoma, a fascinating and generally benign type of kidney tumor. We'll explore what it is, how it develops, and what treatment options are available. Join us as we unravel the complexities of this unique renal mass. The exact cause of renal oncocytoma remains somewhat of a mystery, but researchers believe it stems from genetic changes within the kidney cells. It's thought that alterations in mitochondrial DNA, the energy powerhouses of our cells, may play a significant role. These changes likely disrupt the normal cellular processes, leading to uncontrolled growth and the formation of the tumor. However, the specific triggers for these genetic alterations are still under investigation. At the cellular level, renal oncocytomas are characterized by their distinct appearance under a microscope. They're composed of large eosinophilic cells, meaning they stain brightly with ozone dye, packed with numerous mitochondria. These mitochondria contribute to the cell's granular, pinkish appearance. Unlike malignant kidney tumors, oncocytomas typically grow slowly and are well encapsulated, meaning they're surrounded by a distinct border, preventing them from spreading easily to surrounding tissues. Renal oncocytomas are relatively uncommon, accounting for approximately 3 to 7% of all surgically removed kidney tumors. They tend to occur more frequently in men than in women, and are most often diagnosed in individuals between the ages of 60 and 70. While not typically hereditary, in rare cases they can occur in association with Birt-Hogg-Dubé syndrome, a genetic disorder that increases the risk of developing various tumors, including kidney tumors. Often, renal oncocytomas are asymptomatic, meaning they don't cause any noticeable symptoms. They're frequently discovered incidentally during imaging tests performed for unrelated medical conditions. However, in some cases, larger tumors may cause symptoms such as flank pain, a palpable mass in the abdomen, or hematuria, blood in the urine. These symptoms are not specific to oncocytomas and can be indicative of other kidney conditions as well. Diagnosing renal oncocytoma can be challenging, as it can sometimes mimic other kidney tumors, particularly renal cell carcinoma. On imaging studies, common diagnostic tools include CT scans, MRI scans, and ultrasound. These imaging techniques can help determine the size, location, and characteristics of the tumor. However, a definitive diagnosis often requires a biopsy, where a small tissue sample is taken from the tumor and examined under a microscope. Newer imaging techniques like contrast, enhanced ultrasound, and multiparametric MRI are being developed to improve diagnostic accuracy. Renal oncocytomas are generally considered benign tumors, and there aren't specific classifications or subtypes based on aggressiveness or behavior. However, their appearance can vary slightly under the microscope, which helps pathologists distinguish them from other types of kidney tumors. The key distinction is that oncocytomas lack the features of malignancy seen in cancerous tumors. The primary treatment for renal oncocytoma is surgical removal, typically through a partial nephrectomy, where only the tumor is removed, preserving the remaining kidney tissue. In some cases, a radical nephrectomy, involving removal of the entire kidney, may be necessary. Active surveillance, where the tumor is closely monitored with regular imaging, may be an option for small, asymptomatic tumors, especially in elderly patients or those with significant medical comorbidities. Minimally invasive surgical techniques, such as laparoscopic or robotic surgery, are often preferred for their reduced recovery time and smaller incisions. Currently, there are no known preventative measures specifically for renal oncocytoma. Since the exact causes are still being investigated, general healthy lifestyle choices, such as maintaining a healthy weight, avoiding smoking, and managing blood pressure, are recommended. Regular check-ups with your doctor may help with early detection if a tumor does develop. The prognosis for renal oncocytoma is excellent. Since these tumors are typically benign and slow-growing, surgical removal is usually curative. Long-term survival rates are very high. Recent research is focusing on developing more accurate non-invasive diagnostic techniques to differentiate oncocytomas from malignant tumors, minimizing the need for biopsies. Studies are also exploring the genetic basis of oncocytomas to identify potential therapeutic targets for future treatments.